Dr. J. Maddock is Dean of the Texas A&M School of Public Health and President-elect of the American Academy of Health Behavior. So those are big jobs, and thanks for being here.
Glad to be here, Sharon.
You know, in thinking about health behavior, most of us don't think in those terms, do we?
No, we don't.
So help us understand your mission and your passion.
Sure. When we talk about health behaviors and we look at kind of what are the things that kill people in America and Texas, about 2/3 of early death comes from health behaviors, and the big ones being smoking, physical inactivity, and poor nutrition. And so if we can change these behaviors, we can save a lot of lives in Texas and make a big difference with healthcare costs also.
Fascinating. Now, are you conducting research at this time on what works and what doesn't, and why people haven't changed in the last 20 years in that regard?
Yeah, you know, I just came here, started in February, coming from the University of Hawaii. And we were lucky in the last few years that we got Hawaii to be the healthiest state in the nation.
Wow.
Which is fantastic.
Wow.
Texas is 31st, so we have some work to do here. And my research is in physical activity and nutrition. And so you've probably heard of the obesity epidemic.
Absolutely. I've seen it with my own eyes.
We all have, and it's something I think a lot of us battle. And so we did a lot of research looking at what gets people active, what gets them eat healthier, and what we found a lot was the way the environment is built really affects how active people are and what food choices they make. And so we used to think it was all psychology, and it's actually much more of a complete package, including the built environment and health policies also.
So how can we change that? Do we need to work with builders or developers, or who are you targeting to make these changes and help us do that?
You know, you're right on. We worked a lot with people that build the environment. Something in public health, we don't build the environment, but you know, the School of Architecture here is one that we can definitely work with. We look at things called complete streets, and this is a policy that says when we build a new street that we accommodate cyclists and pedestrians as well as mass transit. It used to be that we try to get cars as fast as possible from point A to point B.
Yes.
And we know what happened is it's really unsafe to bike, and we see that here in the Brazos Valley. There's a lot of places you don't want to get on a bike.
No,
and
hood ornaments waiting to happen.
Yes, exactly. So can we make those changes, and can we work with local policymakers, the people that are building our neighborhoods? You know, are there safe, convenient places to walk to too? Or are you all just in a neighborhood where there's nothing interesting to walk to?
The thing as you're talking that strikes me, I was seeing children in neighborhoods even 10 years ago skateboarding and going from house to house and having some sort of group activity. I don't see that today in many residential neighborhoods. How does your research include that kind of problem?
Yeah, you know, it's really interesting. I think when a lot of us were kids, we walked and biked to school. And now you see the parents driving everyone.
Of course.
And you know, part of it is that we don't have safe routes to school anymore. And so there's been a federal program that we've been looking at and testing the efficacy of, can children walk to school safely? What kind of improvements need to be made? There's also this big fear of child abduction, which is really a fear. If we look at the rates in the 1970s.
It's reality, isn't it?
It's not reality. When I was a kid in the 70s, the rates were much higher. And
really?
Yet we'd all walk into school and play in the playground, and now it's actually much lower, but there's been much more media attention when it does happen. And so there's a lot more fear. And so we work on something that's called free-range children.
I love that.
You know, free-range chickens are great. Free-range children, letting them get outside, you know, in a safe manner, but letting them play, be with their friends, move around, because kids now, what happens is you're afraid, so you have them in the house all the time, in front of the TV, in front of the iPad and the video games, and getting a lot less exercise, so it hurts them in the long term.
Well, that was exactly where I was headed with that. I wanted to ask you, how can we offset what is an epidemic as well as obesity today, and that is the obsession with electronics?
Yeah, you know,
and the couch.
And it is. I'm a parent. I have two boys that are 6 and 10, and I think we're always fighting the electronics. You know, how do we get them away? And so I think really making sure that you're limiting time, that electronics don't become a babysitter. Definitely keep electronics out of your children's bedroom. There should not be a TV in your child's bedroom. You should be limiting iPad time, etc. And then making sure that there's a safe alternate place that they can play. It's, you know, kids want to be outside, they want to be with their friends, and really the iPad is for boredom a lot of times, or the television.
Absolutely. This is the Texas A&M School of Public Health that we're talking with the dean of, and here is information that they put on their website about all the different things that they do, sph.tamhsc.edu, and here's the phone number that will put you in contact, 979-436-9443. And I want to quickly come to your new position, President-elect of the American Academy of Health Behavior. We have about 45 seconds. What do you hope to accomplish in that leadership role in the next year?
Sure. So this is an organization of researchers throughout the country. They have really been focused in the past on the psychological individual aspect, and I think really bringing this broader policy environment to the fold along with the individual basis, just like I talked about, but on a nationwide scale. So
and
hopefully we'll get there.
Is that doable?
I think so. People are starting to change. This younger generation of scientists is coming out, and they're thinking much differently than the people who were trained maybe 20 years ago.
And I can see how that would be, because they've lived it and they know what you're talking about.
Yes, they have. And so it's exciting time, and I think we're really going to see that change happen.
Thank you so much for sharing your insight and your vision. We appreciate it.
Enjoyed being here.